Can't believe it's 2024 and we are still talking about masking. I cannot believe it. I can't believe how politically motivated masking has entirely become. Like, we thought it was off the rails in the middle of COVID. It's totally beyond the rails. We are in outer space now with what exactly is going on with it. I'm going to go over to this article here on Granite Grok, granitegrok.com. I'll put this in the episode description, by Steve McDonald. State rep shows up late en masse for expert testimony on why masks don't matter. This is referring to a testimony of industrial hygienist Stephen Petty, who has decades of experience protecting people from hazards. So when he tells you masks can't stop a virus, that's expert scientific fact. Still, some do not believe. It's a quote from the article, and it's deranged how it's just people on the left that are, it correlates directly to the people that are just obsessed with the state having to take over everything, and the only solutions are throwing money at the issues too. There's no real solutions, and you can see that in their idea with masking. So this right here is referencing New Hampshire State Representative Trinidad Tellez, Democrat, and Director of Health Equity at New Hampshire DHHS, from the Granite Grok, allegedly a researcher. She does have her MD, which is terrifying, and she shows up to a hearing not giving a crap on anything that's brought up by this expert. So to be clear, because I wasn't sure about this at first, industrial hygienist refers to people that understand how to prevent spread of either particles, viruses, different things like that in medical environments, industrial environments. They understand what the masks do, and for a long time, for years, we've known the N95 masks were possibly the only thing that were going to stop COVID-19 virus particles from going anywhere. And first of all, she's here, obviously, with a cloth mask, which is just so annoying. I can't even begin to state how frustrating it is to still see people that are obsessed over masking, still not understanding that cloth masks and those silly food service ones don't work at all. They don't do anything to stop anything. They are there to protect the person there, but they're not stopping the spread or anything of that nature. We need to start paying attention to what the data is showing, and this person showed his slide deck. Let me actually go over to his slides first and see if I can do it in a way that doesn't make people seasick. So he literally publicly posted the slides in this. And concept of industrial hygiene exposure control, PPE, masks, 6-foot rule, why masks do not and cannot work, and what actually works, and damage to children and adults. And this guy's an expert. He's got tons of research experience. He's a professor at Franklin University. He holds patents. Like, this guy understands what it is. And there's a total lack of caring about the science. The science supposedly was the thing that matters when it came to masking. We were told for so long it's the people that are following the science are masking, that we are years away from that being the case. If you're still wearing a mask, you need to honestly look to see what is going on with the data, and the data does not support it. It does not show it stops the spread of the virus. Like right here, this is an important slide, macro view regarding masks. And if masks work, one would expect the curve to drop here, is what he writes. And it looks more like winter when people are inside, or when the viruses tend to spread. There's zero evidence to show it. Virus spread had totally been reliant on people being inside and exposed. It's exactly like the flu. It's exactly like the cold. It has nothing to do with how much stuff you put in front of your face. And going over to, with regards to the CDC, with this slide right here, almost all studies are cited by CDC are flawed because, one, they're not randomized control studies. Very important, they have no control group, so a group that's not wearing the mask compared to with the group wearing masks. And there's also confounding factors in a single study, including masks along with other factors like distancing, quarantine, HVAC changes, and conclude masks had an impact. So all the studies are severely flawed. We've seen this for so long. There's so many medical experts honestly look at the data and are not political actors that have pointed this out. We should not be doing this anymore. It is terrifying people. They're afraid to be exposed to now even the smallest thing. They've normalized masking, which makes people that are totally unhinged when it comes to masking up, that they're now, I want to show this tweet thread, because this person literally created an account called Airborne Aware, where it is entirely about her full bore masking, eyes, face, the whole 9 yards, wearing a respirator with N95, and she's got like a CO2 meter that she's got. She was in a car with a family member, and she still insisted on wearing this mask. This is someone who has been so terrified by the slightest bit of getting sick that she's reverted to this. We have ruined the brains of people that were already paranoid about the world around them and put them in this situation. And people like Representative Tellez are to blame for that. Maybe she's equally a victim. I don't know. But she's a lawmaker. She works for the state under HHS. She should be seen as a leader to making sure the correct data is out there. And to show kind of the mindset of these individuals, you know, so it's entirely people, for the most part, that are leftists, it seems like. They have a very specific worldview, and this carries over to wanting to have acceptance for it also. Like, there was another tweet by Airborne Aware that's, quote, "Today I went to a coffee shop in the unmasked barista was like, oh my gosh, that's the cutest mask, he made my day," and with a crying, smiling emoji. So this is sad. This is sad what we're doing to these individuals. We need to show that, yes, you're going to get exposed to viruses. The world is full of things that could hurt you. That is reality, whether it's physically, whether it's emotional. You can't live life on soft, easy mode, padded room. That is not how it works. You're going to end up with severe psychological consequences. Like, this poor person is like, it seems like her whole identity, her whole Twitter account is centered around masking and covering yourself up. If you're masking, it is not good for you. It is not a good thing to have a piece of cloth on your face, because I don't have the study in front of me, but there are studies that show that you're just re-respirating virus cells over and over again. So if you have the slightest bit of the virus, instead of just exhaling it and getting rid of it and letting the sun and the air just circulate it and kill it, because especially COVID does not survive out in the real world very, very long, we have these individuals that are non-stop masking. So they're just constantly recirculating this. I mean, crazy respirator lady here is probably getting it filtered because she's wearing a full-fledged respirator, which is nuts. But if you're just wearing a mask, you're blocking in spit and bacteria, the viruses you've already breathed in. Maybe you breathed in elsewhere and now it's stuck in there. It's the fibers. N95 masks need to be worn a very specific way. You need to be a healthcare professional that's been trained to utilize them to actually make sure it seals properly. They go through training to make sure they are properly blocking any viruses or other things from getting out into the world or going into their respiratory system. And instead, they are just putting them on wrong, so they're spreading virus anyways. They're keeping virus on them, allowing it to gestate in them even more than would have already been happening. We need to stop. We need to stop the masking. We need our leaders on the left to show it's okay to be exposed to a little bit of COVID-19. It is basically the flu. We need to accept the fact COVID-19 is basically the flu and move on with our day and our life and accept reality for the first time in God knows how long. NewEnglandTake.com. Be sure to like and subscribe for checking this out on YouTube, and we'll talk to you soon.